Let's start by understanding what high blood pressure actually is. Simply put, it's when the force of your blood pushing against the walls of your arteries is consistently too high. Imagine your blood vessels like a garden hose. If the water pressure inside that hose is too high all the time, it puts a lot of strain on the hose itself. In the same way, high blood pressure puts extra strain on your heart, making it work harder, and it can also slowly damage your blood vessels over many years. This damage, if left untreated, can lead to very serious health problems for your heart and brain, like a heart attack, a stroke, or even heart failure. You might wonder why treating high blood pressure in older adults isn't always as simple as it sounds. It's really about finding a careful balance. On one hand, we absolutely need to lower your blood pressure to protect your heart and brain. But on the other hand, we have to be very mindful of potential side effects and how they might affect your daily life and well-being. Older bodies can sometimes react differently to medications than younger ones. And for seniors, specific concerns like constipation, the risk of falling, and your overall energy levels or frailty become really important factors when deciding which medication is best for you. Let's talk about amlodipine, which is a very popular and effective medicine often prescribed for high blood pressure. It's part of a group of medications called calcium channel blockers. To understand how it works, imagine your blood vessels like tiny tubes with muscles in their walls. Amlodipine helps these muscles relax, causing your blood vessels to get wider. When your blood vessels are wider, your blood can flow through them more easily, and this directly helps to lower your blood pressure. Amlodipine is particularly useful for a common type of high blood pressure in older adults, where only the top number of your blood pressure reading is high, while the bottom number is normal or even low. A great benefit of amlodipine is its convenience. Because it stays in your body for a longer time, you typically only need to take it once a day, which can make it easier to remember your medication. Now, while amlodipine is great at relaxing blood vessels, it can also have what we call off-target effects. This means it can affect other parts of your body where we don't necessarily intend for it to work. That's because amlodipine works on something called smooth muscles, which are a type of muscle you don't control, found throughout your body, like in your digestive system, not just your blood vessels. One very common side effect many people experience is constipation. Your digestive system has these smooth muscles that gently squeeze, like waves, to move food and waste along. Amlodipine can relax these muscles too much, slowing down that movement and making it harder for you to go to the bathroom. This can be particularly frustrating for older adults, who might already be prone to constipation. Other things to watch out for include dizziness, which can happen if your blood pressure drops too much. This feeling, especially when you stand up quickly, can increase your risk of falling, which is a major concern for seniors due to the potential for serious injuries. You might also notice swelling in your ankles or legs. This happens because amlodipine widens the tiny blood vessels in your legs, allowing a little extra fluid to seep out into the surrounding tissues. So, how do doctors make sure amlodipine is right for you, especially with these potential side effects? It's all about a personalized approach. Your doctor will often start you on a very low dose, maybe 2.5 milligrams instead of the usual 5 milligrams. This allows your body to get used to the medication slowly, and they can gradually increase the dose if needed to get your blood pressure where it needs to be. They will also closely monitor you for any side effects we just talked about, like dizziness, swelling, or constipation. It's also really important that your doctor considers all your other health conditions, whether you have heart pain or heart failure, for example, as this might make amlodipine even more beneficial. Since many older adults take several different medications, your doctor will carefully review all of them to make sure they work well together and don't cause any harmful interactions. And finally, for some very frail older individuals, the doctor might aim for a slightly higher blood pressure target, prioritizing your safety and comfort over reaching a very strict number. Now let's talk about another group of medications called beta blockers. While they can lower blood pressure, they are generally not the first medicine doctors will choose for high blood pressure in older adults if it's the only major health issue you have. Why is that? Well, studies have shown that other types of blood pressure medications are actually more effective at preventing serious events like strokes in older adults. Also, older individuals tend to experience more side effects with beta blockers, such as feeling very tired, having a slow heart rate, or getting dizzy, which again, can increase your risk of falling. They can also cause sleep problems or even worsen conditions like asthma. However, there's a very important exception. Beta blockers are a first-choice medicine if you have certain other heart conditions. For example, if you have heart failure, if you've had a heart attack, or if you experience chest pain, then a beta blocker might be exactly what you need, and it would be the first choice regardless of your age. Let's focus on those really specific situations where choosing a blood pressure medicine needs extra thought. If you have severe constipation, or a history of something called fecal impaction, where stool gets stuck, or if you have significant problems with urination, your doctor will pick your medicine very, very carefully. Why? Because some blood pressure medications can actually make these issues much worse. For example, amlodipine and other calcium channel blockers, which we just discussed, might be generally good for blood pressure, but they can relax your gut muscles so much that they severely worsen constipation. So, if you have these bowel issues, your doctor will generally avoid them. Similarly, diuretics, or water pills, while effective, can cause dehydration if you don't drink enough fluids. This dehydration can make constipation much worse. And, of course, the increased need to urinate, especially at night, can significantly increase your risk of falling, which is a major concern for seniors. So, what are the better choices when you're dealing with these specific bowel or urinary challenges? In these situations, two groups of medications, ACE inhibitors, ACEs, and angiotensin receptor blockers, ARBs, are often the top recommendations. Why are they preferred? The biggest reason is that they have minimal impact on your bowels or bladder. They generally don't cause or worsen constipation, and very importantly, they don't make you need to urinate more often or more urgently. Beyond that, they are also very effective at lowering your blood pressure and providing excellent protection for your heart and blood vessels. They are also generally well tolerated. ARBs, in particular, often have a slightly better side effect profile than ACEs, especially because they are much less likely to cause the dry, persistent cough that some people experience with ACEs. Common examples of these medications include lisinopril for ACEs and losartan for ARBs. The most important takeaway from today is that there's no single, best medication that works for every older adult with high blood pressure. Your doctor's goal is to create a personalized treatment plan specifically for you. This plan will carefully balance how effective the medicine is at lowering your blood pressure with how well you tolerate it, meaning how few side effects you experience. It also takes into account your unique health situation, including any other medical conditions you have, all the medications you're taking, and your overall lifestyle. Your role in this is crucial. Always discuss any concerns you have, new symptoms, or any side effects you might be experiencing with your doctor. They are your best partner in managing your high blood pressure effectively and safely.